I am Dr. Shantanu Jaradi, founder and CEO of Dentzz Dental. There are plenty of emerging technologies in dentistry across the world, and we are bringing that technology to India as and how it is available. Just to give you an example of a few technologies, you have something called as a 3D CT scan. Okay, we have an in-house 3D CT scan in most of our centers. Now, what that does is that helps in not just in terms of the diagnosis and treatment planning, but also to have a very predictable outcome before performing surgeries like your implant surgeries, as well as once the surgery is done, to be able to instantly evaluate the results of that. That is one. Second is we have something called as the CEREC machine, which helps us to deliver dental crowns in a matter of 1 hour or maybe less. It is like it's like a 3D printed crown. So what happens is, the moment we do the preparation, we do the crown preparation. Traditionally, you would probably take a physical impression, pour a model, send that to the lab, and the lab would take 3 to 4 days to make that. The patient would have to come multiple times. Now what happens, the entire process is digital. So the moment the doctor completes the preparation, a digital scan is taken of that preparation, and that goes straight into the software. So the software has a 3D replica of the tooth. Okay, and using the software, the crown or the veneer is designed, okay, instantly, and that design is transmitted to a milling machine which has a ceramic block, and that mills the block instantly, right? All this happens in a matter of like half an hour to 45 minutes, after which it's just polished and the crown is ready to be delivered to the patient. So traditionally, what used to take 3 to 4 days, now one can do in a matter of 1 hour. This is one technology. Second is in your aesthetic dentistry, you've got something called as digital smile design, which allows us to give predictable and accurate outcomes to any aesthetic or cosmetic case. Patients can also view or get an idea of exactly what they are going to expect at the end of any cosmetic or aesthetic treatment, and there are no surprises for the patient. There is something called as bite scans. Using bite scans, we can accurately assess a person's bite digitally and assess if there are any abnormal forces acting on any one tooth or any one surface of the tooth. Okay, and the possible consequences of that. For example, someone might have a pain in the TMJ, and using these bite scans, we can actually pinpoint the location of the disturbed bite, because of which he's having a pain in his TMJ, the temporomandibular joint, and we can correct that. So there are no guesswork, and there's no guesswork involved in that. Even when we are planning restorations like crowns or veneers or anything that involves the bite, we use the bite scans to ensure that the bite that we are giving to the patient is ideal. Since the last 5 years, there's been a sea of change as far as technology in dentistry is concerned. Like, let's say you compare what was available 6 years back, 7 years back, 10 years back, the kind of technology we have today is absolutely mind-boggling. For example, you have a 3D CT scan which is in-house, allows us to perform treatments in an accurate and a predictable manner. You've got CEREC crowns, in which the crowns can be delivered in just a matter of 1 hour, versus traditionally they used to take around 4 to 5 days or maybe more. You've got laser dentistry. You've got something called as bite scans, which allows us to digitally and accurately measure one's bite and the impact of one's bite on the surrounding structures like your temporomandibular joints or headaches or other associated structures. I always wanted to get into the medical field, and somehow dentistry seemed challenging to me at that point in time when I decided, and that's how I actually ended up in dentistry. And as I started learning dentistry, the various skill sets associated with dentistry throughout my 4 years in college, throughout my internship, I realized that there is much more to dentistry than just clinically treating the tooth or clinically treating the teeth. One has to be absolutely excellent at that, no doubt. But there is also something called as a psychological management of a dental patient. A dental patient doesn't just, the dental patient has got a lot of negative psychology going on inside. Maybe it could be the fear of the root canal, the fear of the dentist, the fear of the dental clinic. And if that is managed efficiently, along with delivering amazing clinical dentistry, then one can transform dentistry, which has traditionally been a negative experience, into something which is an amazing positive experience. And I felt that was the gap which I could sort of cover, and that has been my endeavor since then. So Dentzz as a brand was started by me in 2006. The purpose of starting a brand like Dentzz is for me to contribute to the field of dentistry in as big a way as possible that I could, which I couldn't do having just one standalone clinic. Through this brand, I wanted to deliver an experience which is unparalleled. I wanted to deliver dental expertise which is unparalleled, and bring global technologies to the Indian patients as soon as possible. Whatever we do at Dentzz, we do it with just one sole objective. How do we bring about giving the best to our patients, better than what anyone else is doing in India or in the world, or better than what we were doing maybe 6 months back or maybe a year back. And our entire focus goes in developing systems to ensure that our philosophy is executed. For example, the experience that we want to impart is that of anything but a dental clinic. When a patient walks into our reception, they sort of get a 5-star feel with that kind of a hospitality. Our staff is trained to do so. The moment they go on the dental chair, the doctors that we have a very stringent selection criteria for our doctors. For example, out of every 400 doctors that we interview, we select one doctor. Even after that, the doctor has to undergo a training program which we have developed in-house, not only in terms of clinical dentistry, but also other associated aspects of clinical dentistry like soft skill management, the psychological management of the patient, delivering dentistry in a manner that is as gentle as possible. And only once he undergoes that training program and when we feel comfortable is he or she allowed to work on our patients. Even after doing that, we've got strong back-end monitoring systems so that each and every procedure that happens in each and every clinic of ours is monitored and assessed to ensure that the standards are absolutely world-class and nothing below that. So in terms of research, whatever technologies that we incorporate in our brand or in our organization, whatever materials that we incorporate, we do a thorough background research on that. It's not that someone pitches to us that, okay, this is good and we just buy that. No, we go back to the history. We see what is the clinical research done by that company, what are the trials done by that company, how many years of trials are done and what is the outcome of that. We go in depth, and only when we feel satisfied that okay, this technology is something that will benefit our patients, that is when we actually bring that in. We plan to have our presence across all major metros and cities in India. Currently we are present in Mumbai, Delhi, and we have launched our most recent center in Ahmedabad. Internationally, we have a presence in Dubai as well. When I launched in Ahmedabad, the response that we got was absolutely overwhelming, and that kind of gives us a feeling that the entire Indian market is actually ready and hungry for what we have to offer. And moving forward with this confidence, we will have our presence across as many cities and metros as possible. As of today, all the growth and expansion that we have done, we have not taken any external source of funding till date. All the expansion is funded from internal cash accruals. When I started way back in 2006, I started with a very small capital and a very small budget, and from that, because of the huge amount of cash that we churn, we are able to fund our growth and expansion that we have been doing. Moving forward, we may explore the possibility of having an external investor coming in, but for me personally, I am very particular about the comfort level with who I am dealing with, and it's not just about the money for me.